Okay, now as we continue on chapter 7, I'm on page 73. We were discussing the different types of artifact, including somatic and wandering baseline. I'm on the top of page 73, where you see some of the interventions necessary to prevent or reduce the artifact from occurring. For example, if the skin is wet, if you're experiencing sweat, or moisture, just use a towel, paper towel, some gauze to kind of wipe, kind of clean up that excess sweat and moisture. All skin, like lotion, can be removed with soap and water. Now the outer layer of dead skin cells can be removed by gently abrading. That's just an articulate word for scrubbing. You just want to abrade the skin, which allows the electrode gel to come in contact with more conducive tissue underneath. Dry gauze and a special abrading product can be used for this purpose. You see an illustration of the abrading tape on page 73, figure 7.4. Body hair interferes with electrode contact. Just sometimes you can use a razor or electric clippers. Just make sure that you discuss with your physician or nurse, because some patients may be at a higher risk for bleeding. So you would want to avoid a razor. As you see outlined, a standard shaving razor should not be used, as it can create micro cuts, which can increase the chance of infection. The EKG technician can also place paper tape over electrode to help increase skin contact. Other factors that can cause wandering baseline includes expired or dried out electrodes that can cause the wandering baseline or prevent the machine from picking up any, if at all, electrical activity. The EKG technician should always place the EKG machine level so that lead wires are not stretched. Artifacts caused by electrical interference or broken recording can be caused by factors in the environment. Electrical interference can be caused by appliance or cell phone or other equipment in the surrounding area of the EKG machine. And what you see on figure 7.6 is illustration, an example of an EKG tracing showing electrical interference, and most of the time it's difficult and impossible to interpret. It's real dark and bold in illustration, just like you see in the illustration. Make sure you lean heavily on your figures that you see on 7.2, 7.3, and 7.6. It just gives you a very good depiction and visual illustration of what those particular types of artifact interference look like. Now, some of the interventions you can use to prevent the electrical interference is obviously you can turn off the electrical appliance which causing the interruption, changing the outlet, discontinuing the use of electrical cord on the machine. And honestly, you shouldn't be even using an extension cord on a machine, any type of machine, even just using your naked eye. If it appears like it's disruptive or it needs any type of repair, just send it to a bioengineering department or report it to your immediate supervisor so they can send that machine in for repairing. Making sure that the machine is properly grounded. Now, to make sure that the machine is properly grounded, just make sure that 3 prongs are present on the electrical cord of the machine, and check that the machine is plugged into a 3-prong grounded outlet. That's pretty much how you do it. And just turning off fluorescent lights. That's another intervention you can use to prevent electrical interference. Modern EKG machines have a built-in feature to prevent that anyway, but as an EKG technician, we still are responsible. We have the broken recording, also called interrupted baseline, occurs when the stylus tries to record the tracing on the paper and it goes from side to side to find the signal. Now, the most common cause of a broken recording is frayed or broken lead wires? That's a test question. The EKG technician should inspect the machine before each use to make sure that the lead wires are intact, and if they are broken or frayed, he should report it to the proper person and attempt to obtain a replacement set. And what you see on figure 7.7, that's when you put the stylus on the EKG machine, the broken recording, it'll look just like that. See how it's very distorted. The stylus is going up and down, and anytime you see that, that's more or less the result of a broken or frayed lead wire. Now, for testing purposes, the quick reference guide that you see on page 74 and 75 is going to be your most helpful as you try to determine the types of artifact, the possible cause, and the adaptation and the solution. So what you need to know, for example, just for testing purposes, if the patient is if they're cold, they're more than likely having a somatic tremor. And one of the interventions you want to do, or adaptations or solutions to fix that, is to increase the room temperature. Offer blankets. That's an example of the things that you need to know. We just discussed if it's having a broken recording, that means that the lead wires are either frayed or broken. So you just want to check out the lead wires, look at the wires lead up and down, and make sure it don't have any type of disconnect. Make sure they're not broken, because they may need to be sent to the office for repairing. The wandering baseline, the patient's breathing is creating an interference due to muscle movements. Remember, it's going to go up and down. You will see it just like you see on figure 7.3. So I would highly recommend that you hone in right on the blue box to discuss the type of artifacts, the possible causes, and the solutions. Now, I pretty much read all that stuff to you, but this blue box breaks it down into understandable and easier, and for easier understanding. Now, as I continue on page 75, we are going to discuss the adaptations of electrode placement and patient positions for people in special solutions and pediatric patients. Now, we're going to start with the tip. Any adaptation made during EKG tracing should be documented. Any change from the usual facility procedures, including electrodes placed in a non-standard location, should be noted. That this ensures that the doctor will have all the important facts when he starts to interpret the tracing. Now, what are we talking about here? What we're talking about is some patients require adaptation in order to obtain a clear and accurate EKG. Now, the most prominent adaptation we're referring to is dextrocardia. Dextrocardia, and I'm on page 75. Dextrocardia is a very rare heart condition that causes the heart to develop, essentially just pointing the right side on the chest as opposed to the left. Now, if the electrodes are not placed over the heart, the EKG will not be accurate. Now, if the patient does have dextrocardia, I promise you, 9 times out of 10, the patient will tell you, because the patient has been living and been born with this condition his whole life. So even if in the event, if you walk in the patient room and you discover that the patient is getting a lot of artifact, or if the patient has been diagnosed with dextrocardia, I promise you the patient will tell you. I promise you they will tell you. Even if you attempt to start putting electrodes on the right side of the heart, they'll interrupt you politely 9 times out of 10. Sir or ma'am, I have dextrocardia, and then you will place the electrodes on the patient's chest as you see outlined on page 75. See where it says the patient is usually aware of this condition and is noted in the patient. The only circumstance I can even think of where the patient won't tell you, unless the patient is unresponsive. All right, so now we're going to discuss limb amputation and injury. A patient with limb amputation required adjustment to the limb electrode placement. Electrodes may be placed over the torso or as close as possible to the amputated limb and or limbs itself, but closer to the torso. Now that does sound a little wordy, but the good news is for those who are visual learners, if you turn to page 76, that gives you a better illustration of everything that you see outlined in this paragraph I just read to you. If you turn to page 76, it says, see, in the case of a patient with amputation, the electrodes may be moved closer to the torso or may be placed on the torso rather than the limbs. The limb electrodes on the unaffected side should mirror the electrodes on the affected side. So essentially, all you're doing is just making sure that the electrodes mirror one another. If you look at the illustration on the top left, see how the limbs electrodes mirror one another. You see on lead 2, see how they mirror one another. See how they mirror one another on the bottom. Just make sure that the electrodes mirror one another. Now, in regards to scar tissue or injury on the chest wall, the EKG technician should avoid placing electrodes on scar tissue from a mastectomy or any chest wall injury. Scar tissue can be very fragile and painful, and it definitely is going to hurt when the electrode is removed. Instead, electrodes should be placed as close as possible to the standard location. All right, now you see on figure 710 on page 76, see where the electrodes can be placed around the mastectomy scars and other scar tissues. See the scar from the mastectomy on figure 710. They can be placed around, but just make sure that you are very sensitive to patients' pain level threshold and try to put the electrodes around those sensitive areas. Medical implants, electrodes should not be placed over implanted medical equipment like a pacemaker or even breast implants. If the EKG technician is performing an EKG on a patient with implanted devices or breast implants, the electrode should be placed to the side of the implant, as close as possible to the standard positions. Again, the electrode should be placed to the side of the implant and as close as possible to the standard position. Large breasts. If the patient has large breasts, it is important to remove the breast away from the electrode site as much as possible to allow a placement of the chest wall. Pediatric patients. Now here's the key. Pediatric patients are a little tricky. Pediatric patients require adaptations as well. Children under the age of 2 require a right-sided EKG using the same electrode placement as dextrocardia. And for those who who are yet again visual learners, please turn to page 77. See the figure on 711? See the figure on page 711? See where it says patients under the age of 2? Pediatric patients will have electrodes applied differently than adult patients. Under the age of 2, you're going to apply the electrodes going to the left. And if they're between 2 and 12 of ages, see where everything is the same except V4. V4 will go just right off to the left. So for children from 2 to 12 years of age, the standard EKG electrode placement is used except for V4. Look at the picture. But yet again, for those, you can read this all day, but use your visual cues and clues to help you understand it. See, if they're under 12, you're going to take V1 and 2 and everything goes to the left. If they're between 2 and 12, you're going to take everything else, put it in its proper placement except V4. Now, this is referred to as the V4R placement. These adjustments are needed because the right ventricles extend past the right side of the sternum in small children. That's why you're doing this. The EKG technician should carefully label the EKG tracing to reflect this change. The technician should check with her supervisor and or ordering physician, if she or he is unsure whether an older child should receive a pediatric or adult electrode placement. So when in doubt, You don't have to guess. Just ask the nurse or the physician. And again, the figure on 711 is your cheat sheet. Less than 2, you go to the left. Between 2 and 12, everything is the same except V4. Now, the posterior EKG, you definitely need to know that sometimes a doctor will ask to have an EKG repeated using posterior leads to help diagnose a particular type of heart attack called an inferior wall myocardial infarction. The EKG technician will use lead wires commonly used for V4, 5, and 6 and place electrodes on the patient's back in the locations referred to as 7, 8, and 9. That's V7, V8, and V9. Again, refer to your figure on 712. The patient will be seated while electrodes are placed on the back, but in the supine position, usual for the EKG test itself. Now, what it's simply saying is, if you are recording a posterior EKG, the physician will say, I need a posterior EKG. And in the back of your mind, you're going to start thinking, well, why in the hell am I doing the EKG this way? The reason why is because it's helping him diagnose a particular type of heart attack called the inferior. And remember, inferior means lower wall myocardial infarction. And he wants to see what type of damage the lower part of his heart has sustained while they had a heart attack. Yep. Now, you will see V7 is used in the place to 4. It's located on the back side of the heart, just like you see in the picture. So what you're essentially going to do is you're going to take leads 4, 5, and 6 and put it right in the back. So visually, see where you see V7, V8, V9? You're going to put V4, 5, and 6, and then you're going to scratch them out and put 7, 8, and 9. 7, 8, and 9. Now, for those who are having problems understanding this concept virtually, I can easily show you in person, but it shouldn't be that difficult. But if it is, I understand. But you just essentially taking lead wires 4, 5, and 6 that's already written down on your lead wires, and you put those wires in those anatomical locations that you see on figure 712. And then you record the EKG and you just write posterior on the top. See where it says on figure 7.3? That line just above it. It is critical that the EKG technician change the labels to reflect the actual electrode placement and label the EKG as a posterior EKG. Now, here's the tip. Ask questions and just stay symmetrical. It is difficult to describe every situation that require any type of change in the EKG test, In general, is it just important to remember that lead electrodes should mirror each other. If the arm electrode is placed on the upper left arm, put it on the right upper arm. Just make sure that they mirror each other and they are symmetrical. That's pretty much all you need to know in regards to placing electrodes. All right. Now, but last but not least, we're going to discuss alternate positions of electrode placements. Now, if a patient is over 6 months pregnant, obviously she cannot be placed in a supine position for EKG. Lying down in the supine position can cause the fetus to compress the patient's vena cava and reduce blood flow from the heart. They become weak and possibly lose consciousness. She will need to lie down and be tilted slightly at a 45-degree angle, just like you see in the picture in the 7.4. So what this paragraph is discussing is how you would obtain an EKG and position the patients, typically for a person who is 6 months pregnant. It's just showing you how to place the electrodes and how to put them in a proper position so you can get an accurate and readable tracing. The EKG technician should assist pregnant patients in a modified position, lying down and tilted to the left side. Patients with a history of respiratory or heart problems may not be able to tolerate being in a supine position, so they may experience orthopenia. That's that word again, orthopenia, and they have to raise the head of the bed up to a 45-degree angle just to help with breathing and facilitate breathing. Now, the good news is I read all those chapters just to kind of reinforce comprehension so it can help you understand what I'm saying. But again, on page 78, the quick reference guide, everything you see in the blue is a cheat sheet. And it tells you how and where to properly place electrodes and how to troubleshoot and how to adapt and have proper interventions, aka solutions, for patients with different issues. We already discussed the pediatric patients. We discussed the posterior EKG. So for those, so what I, if I were you, if I was studying, I would focus on this particular chapter because you will see it again. You have a plethora of test questions that could come just from this page itself. I would focus on the quick reference guide, and then I would refer back to the pictures to help me with the understanding. Again, especially when it comes to pediatric patients under 2 years of age, place everything on the right side, everything under the 2 years of age, place electrodes and lead wires on the right side of the chest, as they normally go, but the exception, you just put it on the left. But that may sound somewhat confusing, but just look at the pictures. Look at the pictures right there on page 77. For orthopenia, you definitely know that. Elevate the head of the bed up 45 if they're pregnant, lead amputation, dextrocardia, etc., etc. Everything you just read on the previous pages, good news for us, cheat sheet and its outline right here on page 78. Now, quickly, we want to identify some sources of information for the EKG machine troubleshooting and maintenance. The machine should come with its own operating manual, but the good news for us, when we hired and employed as an EKG technician, you will have an orientation and you receive in-service on how they operate and use the machines in their particular facilities and hospital settings. Failure to follow the manufacturer's instructions could result in patient injury or damage to the machine that would not be covered under warranty. It's our responsibility for basic troubleshooting, including checking the battery, the paper, and making sure the supplies have not expired, especially the electrode tab, because when that electrode has expired, it can produce false readings. If the information in the troubleshooting card does not resolve the problem, just take the machine out of service, report it to your supervisor so they can submit the machine for repair and schedule repair. Most medical facilities have specific policies and procedures for reporting equipment malfunctions and taking equipment out of service. The EKG technician may be responsible for placing an out of service or defective tab on the equipment and just moving it to a designated area where it can be placed out of service and put a tag on it. Now, in conclusion, for Chapter 7, just a quick review. Again, an artifact is interference or distortion that appears in the EKG tracing. Tracings with artifact may be impossible for a doctor to read the EKG accurately. You will need to know the several types of artifact, the patient conditions that require changes or some type of troubleshooting to make sure that the tracing is reading clear and accurate. Adjustal procedures, according to the patient's health condition, whether they're pediatric, whether they're pregnant, or whether they can't lay down flat, so you can know how to adjust and how to obtain EKG properly. Please refer to the figure on page 78. You will see all pretty much in some form multiple questions. And when I say multiple, at least maybe 3 or 4 questions in the total of the 120 of the NHA are all relative to placement suggestions when it comes to recording an accurate EKG. So this chapter here has been pretty heavy in regards to things you can do to prevent artifact, and that's the sole purpose and point of this particular chapter. So the word to the wise, again, is please refer to all the figures highlighted within the textbook to kind of help you visually see and understand what the textbook is saying to you as I read to you. Refer to the quick references and the tips. Now, if you have any further questions, I will be available on Tuesday. Please don't hesitate to inbox me or text me so I can reinforce any type of questions or concerns that you may have. I will discuss with Ms. Tina far as the actual testing date, whether it be Wednesday or Friday for chapters 6 and 7. I hope you all enjoy the rest of your day. God bless you, and may heaven smile upon you.